When statisticians talk about studies, we'll often toss around terms like discrete and continuous, factor and response. And knowing these terms can become really tricky. My name is Jeffrey Franck. I'm a statistician and the CEO of Stat59. In this video, I'm going to let you in on the secret language of statistics so you can talk accurately and efficiently about your research project. To talk about definitions of variable, response, and factor, we're going to use this very simple data set. You can see here that this is the data set from a group of patients who were brought into the emergency department. We see in the first column the answer to whether the patient was or was not admitted to the hospital. And we see that we have a column for age, sex, CTAS, which is their triage score, their pulse, their respiratory rate, their Glasgow Coma Scale, their systolic blood pressure, and whether they came by ambulance or not. We'll use this very simple data set to look at some definitions. The first thing will often come up when we're looking at our statistics is what is the difference between a discrete and a continuous variable? This is super important for deciding on how to manage your data. Well, discrete variables have really just certain values that are allowed. So this may be binary. They can be, for instance, yes or no. They can be categorical, like red, green, yellow. They can be ordinal. Sometimes these are things like class A, class B, class C, or they can be counting, such as numbers. If we were counting, for instance, the number of times someone had gone golfing in a week. For instance, binary, yes, no, true, false, categorical, chemical, biological, radiologic, or explosive, and ordinal triage, T1, T2, T3, T4, or counting number of ambulances. So here's our data set, and we can see that we have a number of discrete variables here. We see that the variable admitted is a binary variable. It's either yes or no. Same with sex, either male or female. In the CTAS group, we actually have an ordinal variable in that the classes go from 1, 2, 3, 4, or 5. And we also see at the end ambulance is another discrete variable. Now, what are continuous variables? Well, continuous variables have an infinite number of possibilities, and these are all the possible values in some part of the number line. So this could be, for instance, the length of time from ambulance arrival to first evacuation, or the weight of a patient. So here we see in this graph, we have a number of continuous variables. Well, age is a continuous variable. So your age basically from 0 to whatever it is. We also see your pulse could be a continuous variable. It can go from 0 per minute all the way to 200 per minute. Respiratory rate, also a continuous variable. Systolic blood pressure as well. So we see on this data set a number of continuous variables. One of the things that is very important when we're working through our data set is to decide what is the response variable. And what are some of the synonyms? We'll see a number of different terms that all mean the same as response variable. Well, the response variable is usually related to the hypothesis of the study. And it's often called the dependent variable, the outcome variable, or the experimental variable. So an example might be if we were studying the number of ice cream scoops sold in a day, or the height of a corn plant, or the pain score after surgery, or some score on a standardized knowledge test. These all could be response variables for various types of experiments. So here in our spreadsheet, we see that for this study, the response variable was whether the patient was or was not admitted. So in this case, the first column, admitted, is the response variable. It's the variable about the study that we're interested in. What is a factor, and what are some synonyms for factor? Well, factors run hand in hand with responses. So factors are the variables that we suspect will influence the response. So these are often known as the independent variables, the explanatory variables, the manipulator variables, or when we're talking about health studies, these can also be called risk factors. So examples of factors might be an antibiotic that is given to treat pneumonia, or a teaching session in disaster medicine, the type of triage system used, or the age of a patient being treated for cellulitis. All of these could be factors that influence a particular response variable. In our small study here, we see that we have a number of independent variables or experimental variables or factors. And that is the age, sex, CTAS, pulse, respiratory rate, GCS, systolic blood pressure, and ambulance, yes or no. So these are things that we suspect might influence whether or not the patient is being admitted. Now, factors can also have something called a level. Now, continuous factors have a value. They have a value of some part on the number line. But discrete factors will have one or more levels in the experiment. For example, if you had antibiotic treatment levels, maybe you're testing the use of different types of antibiotics, and your 3 levels might be placebo, oral fluoroquinolone, and intravenous cephalosporin. Or the triage system used could be an example of a factor level. Here's 3 levels: CTAS, START, or SALT. And again, we'll just look at our small study here, and we see if we pick any one of the factors, we can see that they have certain levels. For instance, we see that CTAS actually has 5 levels: 1, 2, 3, 4, or 5. And ambulance has 2 levels: yes or no. What is a nuisance variable? We'll hear this term pushed around all the time. So a nuisance variable is like a factor that we use for modeling, but it's not really in the purpose of the study. Usually we kind of wish this factor didn't exist or always stayed the same, but it doesn't, so we model to compensate for it. For example, if we wish to know if the time to triage a patient varies with the use of START or SACO triage, the level experience of the provider, maybe they're paramedic versus nurse versus physician, may be a nuisance variable. And it's important to note that whether we continue to consider a certain factor as nuisance or a important factor really depends on the study design. So again, looking at our study here, we might kind of think that maybe sex is a nuisance variable. It's not really going to help us with modeling, but we have to compensate for it. What we would like probably in the end is to derive a prediction rule that didn't have sex in there. So we'll call this a nuisance variable. And then lastly, an important term is the difference between univariate and multivariate data. So univariate are observations on a single variable. So this would be, for instance, if we were looking at a study to look at what is the average pulse of people who come to the emergency department. So this is a univariate study. We would like to just take a look at all the patients who come into the emergency department. We write down their pulse, and then we're going to look at the average pulse or the standard deviation of the pulse and describe what it looks like. Now, multivariate studies are when the observations are made on more than one variable, and usually we're looking for a relationship between the two. So we may be interested to find out if, for instance, the pulse of a patient in the emergency department is dependent on the time of day that they arrive. And that would be a multivariate study. One way to look at these is if you imagine your data in a spreadsheet. In a univariate study, you really just have one column, right? So in this case, we would have every row is a patient in the emergency department. Every column is their pulse. In a multivariate study, we would have more than one column. Here we would have each row is a patient in the emergency department, and there would be a column for pulse and a column for time of day. Now, we went all through these different types of data and different types. Why is this all important? Why is the distinction of these terms, variables, response factor, why is that all important? Well, the choice of statistical test follows directly from these variables. And in some future podcasts, I'm going to be talking to you about how to use the terms response, factor, discrete, and continuous to choose the correct statistical test for your study. So in this video, we saw that knowing the correct definitions of discrete and continuous, and knowing the difference between a factor and a response, can make it much easier to talk about your project and paves the way to choosing the right statistical test. My name is Jeffrey Franck. I'm a statistician and the CEO of Stat59. If you would like to see how the Stat59 web app can help you to design, execute, and publish your next research project, please visit us at our website at www.stat59.com.